Hi, I'm Dr. Scholz. Let's talk about prostate cancer. The 4 different ways that PSA is used are: first, screening; second, for staging; third, for monitoring men who are in remission to determine if they're still in remission; and fourth, to determine if a treatment is effective. PSA screening is really the only way to detect prostate cancer at an early stage. In the old days, they performed digital rectal exams, but by the time you can feel a cancer on the prostate, it's become somewhat advanced. So PSA testing is a remarkable and revolutionary test, able to detect cancers at an early and curable stage. The problems with PSA testing are that early stage cancers are present in the population at large, in men over age 40 and 50. And many of these are harmless and will never spread, never cause any threat to a man's life. Those types of prostate cancers don't need treatment, and you can see really don't need to be detected. So the detection process using PSA has a potential danger of finding these little cancers and leading to treatments that men don't need. So the controversy is weighing between the value of finding cancers early and the potential danger of finding cancer too early and overreacting. The second most common use is to use PSA to stage newly diagnosed prostate cancer. Specifically, there are 3 broad categories. PSA of 1 to 10 is a low risk category. PSA of 10 to 20 is an intermediate risk category, and PSAs above 20 are a high risk category. Now, you should be aware that PSA can be influenced by things that wouldn't be expected. For example, your PSA right after your biopsy can jump 10 points. Use the PSA prior to the biopsy for making staging calculations. The PSA is not going to stay high after a biopsy. It'll stay high for perhaps 2 to 6 weeks and then come back down again. So for accurate staging, use the PSA prior to the biopsy. The third way that PSA is used in the prostate cancer world is to monitor men who've had previous surgery or previous radiation. Effective treatment will lower the PSA down usually to less than 1, with surgery to 0, and the PSA should remain there indefinitely in men that have been cured. There's a specific methodology for monitoring PSA after surgery or radiation. Typically, men have their PSA tested every 3 months for 2 years after their treatment. Subsequently, for the next 3 years, they'll have their PSA tested every 6 months. Now you're at 5 years, and after 5 years, men can have their PSA tested once a year, all of this assuming that the PSA remains low and stable and the patient is still in remission. Having a detectable PSA after surgery is a clear signal that the prostate cancer is recurring. It's not so clear-cut for radiation because the prostate is still in place and the prostate gland can make low levels of PSA. So it does take some expert interpretation to determine when a rising PSA after radiation is a prostate cancer problem or merely a residual prostate gland problem. When people talk about PSA and the controversies surrounding it, there is no dispute that PSA is probably the best test available for detecting relapsed cancer. There's a fourth role for PSA in the prostate cancer world. That is to determine if a treatment is working or not. If the PSA is declining after treatment, the general assumption is that that treatment is working. If the PSA is continuing to rise, the assumption is that the treatment isn't working and needs to be changed. There are many exceptions to this general rule, but that's how doctors function in the day-to-day management of advanced prostate cancer. So we've covered 4 different ways that PSA plays a role in men with prostate cancer. Thanks for watching. If you've enjoyed this video, please subscribe to our channel. If you'd like more information, you can go to our website, pcri.org.